Coming to the basics of orbit. Orbit is the place where eyeball is located. It is just a moment. It is pyramidal in shape. Nobody will ask you in this question. If you are about to fail, then they will ask. Coming to the walls of orbit, there are 7 bones which form the bony orbit. Questions which come: which is the thinnest wall? Medial wall is the thinnest wall. Which are the bones forming the thinnest wall? From anterior to posterior. Anterior to posterior. I remembered it as MLES. Maxilla, lacrimal, ethmoid, sphenoid. Easy enough? You can keep imagining because you can feel your orbit. The lateral wall is the strongest wall, so least prone to injury, and it is protective to the eye wall as well. Coming to the floor is the weakest wall. Weakest, and what does this MC mean? MC mean it is the most common wall. Most common wall to be fractured. CT scan sign. A frequently asked question. Teardrop sign. Nerve injured. Again a frequently asked sign. Infraorbital nerve. Now my question to you all, you have to comment. You have to answer this. I am not going to answer this question. What is a trap door fracture or wide-eyed blowout fracture? Answer this in the comment section. Moving on, we'll go to the next topic. We are just going through the basics. So don't expect that I'll teach whole orbit or everything. We'll go step by step. You just have an hang over it. Get the hang over it. Then we can easily understand. Coming to aqueous humor. Who produces it? Ciliary process. Where is it present? Pars plicata. Which is the other part? It is pars plana, which has been mentioned before. Go through the previous videos. What is the mechanism of action? 3 types: active, diffusion, ultrafiltration. What is the rate of production? It is an MCQ and a Viva question. 2.3 microliters per minute, and this is constant and doesn't change with any book. Coming to the outflow. %90. via trabecular meshwork to Schlemm's canal. 10% via uveoscleral outflow to suprachoroidal space. These are very important points while we come to anti-glaucoma medications and study about glaucoma. It is all based on this thing called aqueous. Adding on, anterior chamber has 0.25 ml of aqueous, posterior chamber has 0.06 ml of aqueous, then the total is 0.31 ml. Again a question which is at par with all the books. Hope you are clear with all these till now. Now coming to something very important, embryology. I'll be giving mnemonics so that you remember, because it's a very volatile and asked questions in ICO exams, basic sciences. Surface ectoderm, neuroectoderm, mesoderm, and last neural test cells. Pardon me for my handwriting. Handwriting doesn't matter, knowledge matters. So, coming to the first one, surface ectoderm derivatives, we have 3LC, lacrimal apparatus, lids and their glands, lens, conjunctiva and corneal epithelium. See, the concept is anything which is outside epithelium will come from ectoderm. Muscles come from mesoderm. There are some exceptions, definitely. Coming to neuroectoderm derivatives, we have the optic nerve. We go to the posterior segment basically in the neuroectoderm because it consists the word neuro. Optic nerve, retina, ciliary and iris epithelium. Exceptions being sphincter and dilator pupillae. I hope by now you know these are the muscles of constriction and dilatation of the pupil. Zonules, as I mentioned before in the previous video, the bag which holds the bag of lens. Vitreous gel. Now this vitreous gel is a bit tricky. It has multiple derivatives. We'll get to know it very soon. Coming to mesoderm derivatives. Choroid. Choroid is a part of the ICC. ICC was the part of uvea, as you all know. Now the twist comes. Primary vitreous is from mesoderm. Muscles. Muscles have a M. M for muscles. Which muscles? Extraocular muscles. Another exception, sclera, but only the temporal part. You must not forget these. These are Viva questions, these are exam questions. And last but not the least, the NCC derivatives. I would suggest you remember the NCC derivatives and the ones which are marked in red. It will be easier for you. Ciliary muscle. Pardon me for my short stance. Again, all the layers of cornea. But you can see corneal epithelium has already been formed by the surface ectoderm. Rest of the layers, Bowman's, stroma, desmae, duas, endothelium is by neural crest cell. Most of the sclera, again, these are the tricky parts which you must remember. Presenting one more. Extraocular muscles, but they're tendons. These tendons and belly, these two things are very important for Graves' disease, thyroid ophthalmopathy. Once we get over there, I'll tell you which is tendon sparing, which is belly sparing. I'll tell you all. Neural crest cells coming again, orbital bones. All the bones are formed. Trabecular meshwork, Schlemms, basically the angle of anterior chamber. Last but not the least, melanocytes, which give all the pigments to the eye. Next, few volumes which we must remember. Be it ICO, DNB exams, you have to begin with the anatomy, and if you can write the exact quantity or be around it, you will score good marks. Since I have passed my MD, MS and DNB exams, ICO first part in a single attempt. Volume of orbit 30 cc or ml. What is the volume of eyeball? This was my MS exam Viva question. 6.5 ml. What is the volume of vitreous? 4.5 ml. Not important. You can avoid it. And aqueous humor, I have mentioned it. Check it in the previous slide. I hope you are getting a hang of this basic ophthalmology so that we can slowly start chapter wise. Another last topic for the day from exam point of view and practical exam. These are practical questions, and if in theory exams you can start, like in theory exam there will be a question, describe about the walls of orbit. If you can start with the volume of orbit and then explain the walls of orbit, you will be on having an upper edge. Coming to refractive indices, very easy. Aqueous or vitreous, cornea, lens, cortex. Be very careful. Cortex and nucleus have two different indices, 1.39, 1.41. Mug this up, because nobody is going to ask you about cornea. It is just 1.33. Anybody can remember, revise it thrice. 1.37, sorry. My mistake. Aqueous and vitreous is 1.33. Can you tell me the tear film production rate? We all cry sometimes. The rate is you cry at the rate of, or the tear film production is at the rate of 1.2 microliters per minute. And aqueous humor, I have already told you, 2.3 microliters per minute produced by the ciliary processes with two outflows. I'll explain all the drugs which act on which outflow mechanism. Thank you for listening. Take care.